At 7:16 this morning, have you ever called a doctor's office for an appointment and been told that the next available appointment is months away? Well, the same thing is happening to families across Middle Tennessee. In this latest edition of Growing Nashville, Fox 17 News' Johnny Mathey is talking with local providers about the challenges of trying to expand to meet demand.
From Montgomery County down through Middle Tennessee, patients are waiting a long time for appointments with doctors. AMN Healthcare released a study back in May, finding wait times are up 19% since 2022 and 48% since 2004. And that's even longer for OBGYNs and other specialists.
When I need to see a doctor, I need to see a doctor.
Heather McCall has a 1-year-old at home. She's dealing with delays for her and her son across multiple healthcare networks.
Can I go see my regular doctor or do I go to urgent care? And then I go to urgent care and it's somebody who doesn't know me.
At one point, her son was on a 6-month wait list for an operation. Babies tend to double in size in 6 months. That's precious time ticking. The waiting began when she found out she was pregnant.
This was in middle of October. And they were like, he doesn't have anything until December. And I was like, I can't, this is my first baby. I'm just coming out of a fertility clinic. I can't just go 2 months without seeing an OB. So they're like, well, you can see the NP. And I got in with the NP and they were like, you were too complicated. Why are you seeing
Yeah.
And I was like, because the OB didn't have anything.
Right.
But we do look at data.
Daphne David is CEO at Ascension St. Thomas Rutherford. Her hospital group sees the growth gap between the needs and service.
What led to that, do you think?
Well, if I think about a few service lines, primary care, for example, it's really difficult to be in a private practice. And the pressures with insurance payers and the cost of doing business is really difficult. And so
David says burnout after COVID is one factor in the expanding wait times for patients. Another factor, having to offer more competitive salaries to compete with job opportunities beyond healthcare.
What are you guys doing to combat it specifically?
Well, we're working diligently to help support our physicians in any way that we can. And we are looking to continue to expand our footprint from a primary care perspective, whether that's recruiting, whether that's supporting, whether it's providing management services to physician offices.
Ascension is one of multiple networks expanding in hopes of meeting Middle Tennessee's needs, especially in Rutherford County, which is one of the fastest growing counties in the entire state. David says the birth rate is up there, so Ascension is trying to expand the infant ICU and programs for new moms. They just added beds to the adult ICU too. And the hospital group recently built its West Lawn location, a short drive from the Rutherford location, to meet people where they're at. The CEO tells me completing a cardiac program is one thing in the works at West Lawn. Ascension is also expanding to Clarksville, and it is not alone. I went to Montgomery County to talk to TriStar about its expansion efforts.
We have been very busy trying to build new facilities to meet the demands for more health care, and especially in Clarksville.
TriStar's VP of Development, David Whalen, got a plan approved for a $286 million facility to fix what former Mayor Jim Durrett says is a hole.
It's basically a healthcare desert out here. And I can guarantee you that this emergency room will save lives, without a doubt.
So how did we get here? Hospitals need a certificate of need granted. This is just the checklist for it right here. It's an application, a 15-page application, where medical development groups pitch a need for specific hospital services in a specific area. The state's Health Facilities Commission must approve that application.
We reached out to ask about the commission's effort to address rapid growth, long wait times, and doctor shortages. A commission spokesperson says they don't do interviews. We still have a requested, but in an email the commission says it, quote, does not regulate physicians' practices, going on to say, however, access to care and benefits to consumers from increased competition are important considerations in the certificate of need decisions, end quote. For example, Tenova Hospital is currently caring for Clarksville. In a statement, that network says it does not think there's a need for more facilities of physicians, but Whalen hears his patients losing patience.
This is the fastest growing zip code in all of Clarksville, so when we're looking for a site, we look at demographics and try to figure out where we can best meet that need.
I don't think that we have enough providers for the explosion of population growth that we've had in this city.
All right, so you heard Heather there talking about the growth. the growth isn't stopping. And Ascension St. Thomas does recognize this, saying it plans 5 to 7 years out and beyond. The projections go beyond 7 years.
So, Johnny, the big question here is, where does staffing play into all of this?
All right, so I talked to TriStar Clarksville about that, and leadership says they're prepared to, as they put it, staff it up. Because, Justin, you know this line, if you build it, they will come.
Yeah.
Might not be the thing anymore. If you staff it, they'll probably come.
Well, it sounds like they're already coming here, so
Yes.
they've got to prepare for the wave that continues to push their way here.
Definitely,
so.
and the nurses, they say in their network already, some of them do live up in Clarksville. That's part of the process, too.
All right, Johnny Maffey, thank you so much, sir. We appreciate it.